An AI doctor that can see inside the human body? Google just made it real. Meet AMIE, the artificial medical intelligence engine that could change medicine forever. AMIE stands for Articulate Medical Intelligence Explorer. It's Google's latest leap into the future of healthcare, an AI model trained not just to analyze medical text, but to see and interpret medical images like X-rays, kinetic scans, and more. Unlike earlier AI tools that relied purely on text or numbers, AMIE combines language understanding with visual analysis, making it closer than ever to a real digital doctor. At its core, AMIE uses a multimodal AI approach. That means it learns from both textual data like doctor's notes and visual data, such as chest X-rays and MRIs. It can diagnose conditions like pneumonia or lung cancer, understand symptoms described in plain language, and even explain its reasoning in simple terms. Think of it like ChatGPT, but trained for the ER. In tests, AMIE performed on parer even better than real doctors in certain diagnostic tasks. One study showed it accurately answered patient questions and provided appropriate follow-ups with a bedside manner that felt surprisingly human. That doesn't mean it replaces doctors, but it could become a powerful second opinion. The most promising use? Rural and underserved communities. In places where expert doctors are scarce, AMIE could provide early screenings, flag urgent conditions, and help overburdened health systems catch up. Imagine a local clinic in a village, powered by cloud-based AI that sees what only specialists can. But it's not all perfect. Critics warn about data privacy, the risk of misdiagnosis, and the need for strict regulation. Google says AMIE is still in the research phase and not yet available for clinical use. They're working with medical experts to fine-tune accuracy, eliminate bias. Google's AMIE isn't just another AI project. It's a glimpse into a future where machines don't just process data, they understand life, illness, and maybe even healing. Would you trust an AI to read your X-ray? Let us know in the comments below.
In controlled studies, AMIE performed comparably, or even better, than experienced physicians in certain diagnostic tasks. It could answer follow-up questions, ask clarifying ones, and explain symptoms and treatment plans in patient-friendly language. Google says this brings AI one step closer to becoming a trustworthy medical assistant. Traditionally, AI tools relied on structured data or written reports, but AMIE takes a leap forward by using advanced deep learning to interpret medical images directly. It looks at chest X-rays, identifies patterns of disease, and then communicates its findings in natural, human-like language. For example, it can detect pneumonia in a scan and say, "There is an area of opacity in the lower lobe suggestive of infection." In many parts of the world, access to specialist care is limited. AMIE could serve as a second opinion in remote clinics, helping health workers make faster, more accurate decisions. It could also speed up triage in emergency settings, prioritizing the most critical cases. Future prospect: Google AMIE represents a groundbreaking shift in how artificial intelligence may be integrated into healthcare. But this is just the beginning. In the near future, AMIE could evolve into a fully integrated AI assistant for doctors, capable of handling multiple diagnostic tasks, managing patient histories, and even aiding in treatment planning. Its ability to process both medical language and visual data, like X-rays and CT scans, means it can support real-time clinical decisions, not just offer second opinions. As the technology matures, we might see AMIE built into telemedicine platforms, helping patients get preliminary diagnoses from home, used in rural or under-resourced clinics, acting as a virtual expert where no specialist is available, collaborating with human doctors, offering insights, probabilities, and missed risk factors, personalizing treatment plans by analyzing large volumes of patient data quickly and accurately. So, where is Google AMIE headed next? Experts believe this AI could soon become a fully integrated digital assistant for doctors, one that not only sees medical images but helps analyze patient records, suggests treatments, and even flags overlooked risks. In the future, AMI might be embedded in telemedicine platforms, offering real-time diagnosis support to patients from their homes. It could become a lifeline in rural clinics where access to specialists is limited or non-existent. Rather than replacing doctors, AMIE is designed to work with them, offering fast, data-driven insights while the human expert focuses on empathy, ethics, and care. From managing overworked emergency rooms to supporting global health initiatives, the potential impact is massive. But full deployment depends on trust, transparency, and rigorous testing. Still, one thing is clear: AI like AMIE is not just the future of healthcare. It's already knocking at the door.